I'm Dr. Ray Christensen from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, and I am your host for tonight's program on healthy living and seeking balance. The success of this program, again, is very dependent on you, the viewer. Please call in your questions, and we will do our best to address them. The numbers for your phone calls and questions can be found at the bottom of the screen. Tonight, our panelists are Dr. David Lear, a family physician with the Rader Clinic in Cloquet, Minnesota, Dr. Jake Panuski, a family physician with the Lake Superior Community Health Center and a faculty member of the Family Medicine and Community Health Department at the Medical School in Duluth, and Dr. Dan Tomaszewski, a PharmD with the College of Pharmacy and Essentia Health. Our medical students answering the phones tonight are Nicole Jadolinsky from Maryfield, Minnesota, Christy Johnson from Foxborough, Wisconsin, and Linda Liskowitz, the coordinator of Doctors on Call, this program. And now on to tonight's program, on healthy living and seeking balance. Gentlemen, as we had talked earlier, I thought probably it would be best we start out tonight with just a thought from each of you on the question that we're looking at tonight, healthy living and seeking balance. Dr. Lear, do you want to start out with your thoughts on this?
Well, sure. A number of years ago, some authors from Duluth, Don and Nancy Tubising, wrote a book on balanced life and living, and they talked about some things that they thought were important. I think it's worthwhile just talking about them. They thought that it's important to have something that's stimulating or intellectually stimulating in life, to have a sense of belonging or some interaction with people that is important to you, someone that you care about. Spirituality is important. Other things I think that are important are to remain physically active. And I think that those, and then a healthy eating style, I think are important. It's a good book that Don and Nancy wrote a number of years ago.
Dr. Panuski?
So when I think of health, there are a lot of things that are beyond our control. The environment that we find ourselves in, politics or money or other things that we don't have control over. And when I think of how healthy living relates to health, I think of it as sort of those things that we do have control over, the decisions that each of us can make that will impact our health in a positive way. And I think of health as being able to do what we want, when we want, more or less without limitation, or at least with limitations that are acceptable to us. And so when I look at seeking balance and healthy living, I look at, well, what are those things that I can do and that each of us can do to make our health and quality of life better?
Thanks, Jake. Dr. Tomaszewski, just for the audience's sake, Dr. Tomaszewski is a PharmD working on a PhD, which makes him, I guess, in the traditional way, a pharmacist, but the new PharmD that we are utilizing in the pharmacy world. His addition to the panel tonight adds a different dimension to it, so I'll bring that question to you now, too.
Yeah, absolutely. And I think that a lot of what the other panelists said very similarly comes through in the pharmacy side of things, but we think of it maybe also in consideration with working with your medication, that a healthy balance of adhering to your medication the best you can, as well as working in those healthy daily livings. So remembering that physical activity is just as important as your blood pressure medication. Your diet is just as important as maybe that insulin that you're using along with it to treat your diabetes. And then also just remembering maintaining a good, healthy stress level throughout the day, making sure that we're considering mental health as well as your overall physical health as well.
Great. Go ahead, David.
I was just the chair of the ICSI guidelines
What's
on
ICSI?
hypertension.
What's
the
ICSI?
Institute for Clinical Systems Improvement. And they write guidelines on how to take care of the major diseases that we have. And we were talking about hypertension. And this year, the real emphasis was that we talk not just about medications that we use, but we do really need to look at the healthy lifestyle, the importance of getting exercise, 30 to 40 minutes 5 times a week, to have a good healthy diet, the DASH diet, the diet against systolic hypertension, which includes more fruits and vegetables. Getting enough sleep and adequate sleep are important as well. But those are the type of things that we're looking at as being as important, as you mentioned, as the medication that we use.
It's interesting that the reason we chose the title of this show for tonight is we're coming into we are in the holiday season. It probably started a month ago with Thanksgiving, and it's a time where a lot of excess goes on. At least I have to fight the excess that's out there. Maybe we could address some of the stressors at this time of year. There's everything from the stress on diet to family to anxiety to depression, and we have a lot of things to start with. Jake, what do you see as maybe one of the most important pieces at this time of year for your practice?
Well, I think there's a few things that start to happen this time of year. Many of my patients become stressed out around the holidays for many different reasons. The other thing is tomorrow, I believe, is the shortest, darkest day of the year. And as the sunlight goes away, oftentimes people find it harder to get out and be active and to go about those things that they find pleasure and enjoyment with. This is also the start of flu season, and certainly there are lots of colds and cold viruses traveling around right now. So lately in clinic, I've been seeing a lot of people with colds and upper respiratory infections, and a lot of people dealing with the stress associated with holidays and holiday travel.
So, David?
I just wanted to emphasize this seasonal affective disorder that you were talking about, the shortest day of the year. That's a type of depression that is just associated with just not having enough sunlight a long enough time. And so sometimes we actually recommend that we have some extra light that we're around to try to extend the day, that we're be in a light box and actually read in front of a light box earlier in the morning and later in the night to kind of try to trick our brain into thinking that it's a longer day. But just recognize that because of the seasonal affective disorder that hits many of us, it's an important time to be getting the exercise that'll help fight that depression, and just recognize that the days will be getting longer, and this moodiness that a lot of people see around and we see in our clinic a lot, it'll be getting better.
Dan, I was thinking about the sleep piece of it and the importance of sleep and balance. So one of the first questions that popped up is, how much sleep should adults and kids get each night?
You know, it's an interesting question, and it's one of them that, you know, it's a quick, easy answer where somebody can jump out and say, well, 8 hours is the normal amount of sleep a person should get. But realistically, a lot of the studies, sleep studies that go on, it's more of a person-by-person kind of thing that you got to take a look at. You need to think about yourself as how much sleep do you need to feel well-rested the next day. And some people can operate on as little as 4 hours of sleep, feel well-rested and well-rounded, whereas others may need up to 10 hours of sleep to get that same feeling. You know, it's all about finding a good balance for yourself, being able to say, okay, I don't feel like myself if I cut off 4 hours of sleep and I'm only working on 6. So finding where that number of hours that really works well for you is the best. And understanding that, you know, with this additional hours of darkness, we may get in this mode where we feel like we need more sleep. And sometimes that can be a bad trap to fall in as well, because when we take away the extra, or add those extra hours, we maybe lose some physical activity, and we start to feel not like ourselves that way as well. So it's all about figuring out and then not letting the extra hours of darkness creep up on you and increasing those hours just because of more darkness out there.
Statistically, I would just throw in that as we look at the number of people that are sleeping the less and less hours, there are very few people that get along with 4 hours. And on average, it's the minimum should be in that 6.5 to 7 hour range. And too often in today's lifestyle, we don't get close to that.
Yeah, I would absolutely agree with that, yeah.
It also depends on how old you are. Kids generally need more sleep than adults. So if you have a teenager or you are a teenager, I mean, teenagers may need, 10 or 11 hours of sleep to be as functional as they can. Infants obviously get much more sleep than older people do. A lot of people associate decreased sleep with aging, but that's not necessarily because people who are older need less sleep. I think sometimes as we age, we develop health problems which actually get in the way of good sleep. So I actually like what you said about making sure that each person is getting enough sleep to feel well rested and get done what they need to get done during the day. But also would echo what you said in that I do think, for me, I generally try to discourage people from getting less than about 7 hours of sleep unless they've got something else going on. I mean, the master of meditation or self-hypnosis, or have some other way of attaining a level of function that most of us don't achieve in our daily lives.
Good comments. So let's go on to a little bit more controversial then. How important is an active sex life? Does that help keep you balanced?
Yes. Next question. No, so I see a lot of men in my clinic for erectile.
This was asked by a woman.
Very good. I see a lot of men in my clinic for erectile dysfunction, and an important sex life is very important to a healthy relationship, both of which contribute very meaningfully to our sense of well-being for men or women. I think that because of American cultural norms, sometimes this is a really hard thing to talk with, either with your partner or with your physician. And I would simply encourage anyone who has concerns about their sex life, if they feel like things aren't working or meeting their needs, it is something that's very appropriate to talk with your physician about or other health professionals, and see if getting support or guidance or improvement can't help improve your life in that area. The other important piece is that sometimes sexual problems or sexual dysfunctions can be a sign of other health conditions that can be treated or managed in different ways. People may think they have a problem with their sex life, but it's really related to something else that can be addressed in a different way. Again, that's where seeing your health provider can be very important.
And this kind of rolls back around to depression
Mm-hmm.
as one of the problems.
I think of depression, I think of vascular disease, I think of smoking, I think of other personality issues, diabetes, and so forth. So there are a lot of different things that, as a physician, I think about when someone says they have concerns about sex or sexual functioning.
Dan, you were leaning into this one.
Yeah, I was just going to add that it's being comfortable and able to talk about something like this is very helpful, because you also have the side of it where sometimes some of your medication side effects can cause some issues related to having a healthy sex life. And that can be an increased stress around the life, and then can turn around and maybe discourage you from taking your medication. And having that open communication with your pharmacist or your physician that you see, you can discuss with them maybe better options for yourself that would not hamper your sexual capabilities, as well still treating whatever condition that medication may be for.
Especially a problem that we see with many of the antihypertensive medications or blood pressure medicines.
So the tough question, as long as we're giving advice, how do you keep balance during this time of year with work, Christmas preparations, and this crazy time of year? Any personal advice?
Personally, I'm a runner. What I like about running is you can do it quickly and find some time throughout your day to kind of squeeze it in. I know we talked about skiing a little bit earlier, and that's another one of them that you can sneak in a little bit of physical activity, and that can go a long ways. You don't necessarily need to put in an hour's worth of workout, maybe that 15-minute brisk walk or a brisk run, whichever you feel comfortable with. And I've got a new puppy at home, so taking it out for a walk, that could be enough just to break up the day a little bit, relieve some of that stress, and then kind of go back to the things that need to be done.
I did enjoy a little time at Snowflake just before this program tonight, so I enjoy cross-country skiing.
So David, I know that you're a staunch exerciser. I don't know about Jake. We know that you are from what you say. So the question is, how many times or days a week should a person exercise?
Well, I mentioned this a little bit earlier, but I think that 4 to 5 times, and I always recommend that a person try to get some exercise that's about 30 to 40 minutes. And people say, well, how hard should I exercise? And there are heart rates that we can like to achieve, like 70% of what your maximum heart rate should be for your age, perhaps achieving that. Some of the medications that we use that'll prevent that heart rate from going up. So my rule of thumb is I tell someone that you need to work out hard enough to build up a sweat. And I think that that's a pretty good guide, that we're getting that heart rate up, that we feel like we're working a bit. But there's more and more evidence that getting that type of a workout is important for not only our physical health, but it improves our sleep. And even as we're talking about senior citizens, it actually prevents the dementia from getting worse. And so it's a good preventative activity.
Helps your sex life too.
It keeps the circulation flowing, yes.
Yes, it does.
You asked earlier how to keep balance during a very busy time of the year. And I think the two things that I think of most are, it's actually okay to schedule your life and schedule things, but we all know our schedules fall apart. One of the pearls of advice I give to my patients is do the important things first in the morning, because something always comes up. And if you're planning on doing important things late in the day, there's a greater chance that they're going to get derailed or put off until a later day because you're tired or something else has arisen. So do those important things first. I think we spend a lot of time doing the stuff we think is urgent and not really a lot of time doing the things that are actually important to our lives.
Does stress cause heart attacks?
Stress contributes to the things which cause heart attacks. So most heart attacks are due to blockages in our blood vessels that break loose and block the arteries that supply blood to the muscle that is our heart. And stress does all sorts of bad things to our body. One of those things is that it increases the likelihood of developing those plaques, and it increases our ability to respond or heal when we're at risk for a heart attack.
Not only does it create the plaques which then break loose and cause a heart attack, but it also can cause some spasm in the coronary arteries. I've actually taken care of a number of couples where one of the spouses developed a heart attack, and within a half a day the spouse has actually developed one, probably because of the stress, and perhaps because of the lifestyles that led them to that. They maybe had a higher cholesterol diet so that they had more plaques. But I think that stressors do add to it, even on an acute basis.
And I would agree. I think it's all contributing factors. There's usually multiple things that go on leading into an event like that. So stress can definitely contribute, especially in that short acute phase.
Is this a time, David, I know that this is an area you like a lot, don't like, you're very good at it, in talking to it, and that's depression. It seems like the holiday season is a time where things don't always go as they should. People get frustrated. Maybe Uncle Johnny and I don't get along like we should have, and then we have other problems. You want to talk a little bit toward depression in this time of year?
Yeah. I think part of the reason that we bring this up again is because it is the shortest day of the year, and all the stressors are present that seem to add to that. Many times at the holidays we remember loved ones that are gone and are not with us at this time. I think it's worthwhile just for our audience to know what our definition of depression is. We call it a major depressive disorder. If a person has 5 out of the 9 components, and I'll just go through them. If you felt that this is present for most of the time in the last 2 weeks, you probably have some depression. So first of all, if you're feeling depressed most of the time, that might be pretty obvious. But not always is it feeling depressed. Sometimes you're having difficulty sleeping at night, and that may be when it's one of the components. Another one that's very important is that you may not feel that you're depressed, but you say, I just don't have any interest, or I don't care about anything. We call it anhedonia, no hedonism, but just not caring about anything. And you do need to have either the sleep, either the depression or this loss of interest is one of the components of those 5 that we're talking about. And then is guilt. We say that, I'm really feel like I'm letting my family down. I'm just not doing the things that I'd like to do. I feel like I'm just not contributing the way I'd like to. Our energy, the next one is energy. Our energy is low. We feel like we're just not able to get up in the morning and have the energy to do things. The next component is concentration. And actually in seniors sometimes we'll think that a person's developed dementia, and actually they just have depression. They just can't remember because the concentration. So they'll say that they can't feel like they're concentrating even to read the paper and the baseball scores or things like that. The next one is appetite. And it can, in some types of depression, we actually lose a lot of weight. In other types of depression, we actually eat constantly and gain weight. The 8th component is psychomotor retardation or activation. A person feels that they're so fidgety they just can't sit still, or else they feel like they're so slow that everybody else is walking twice as fast as they are. And then the last one is called suicidality, and suicide, or thinking about that, is certainly one of them. But sometimes people just would say something like, well, I wonder if the world wouldn't be better off if I weren't here. But if a person has 5 out of these 9, then we should think that there may be a real significant part of depression going on. And if there is, there are some ways that we can deal with that. We've talked about exercise. That actually changes the endorphins in our system, and that's really important. But also counseling can be helpful if we have mild to moderate depression. And then we have some very good medications which are not addictive, but are very helpful and deal with depression. And I think that that's something that we should think about if this depression continues.
So I'll pull us on to some other topics now a little bit. We talked about sleep. The person wants to know, if I wake up 3 or 4 times a night, how do I sleep better through the night?
A lot depends on why that person might be waking. And I think this is a good reason for someone to go talk with their healthcare provider. There's a whole lot of things which can cause people to wake, ranging from pain to sleep apnea to mood to just having to use the bathroom to an uncomfortable bed to noise in the hallway or in the neighborhood. So there's lots of things that can be contributing to that. And I think identifying the underlying cause for why a person's wakening more frequently is the first step in fact, necessary to figure out how to help that person sleep better. So there's not a one thing which is going to help everyone sleep. It's rather identifying why this person is waking up and then addressing that problem. That's important.
I'd like to really emphasize the sleep apnea part that I think that we don't find often enough. And if your spouse says that they're afraid that you're not going to wake up because you're snoring and all of a sudden stop breathing at night, and they wake up because you haven't breathed in that time, get in and get that checked, because that really is something that we're dealing more and more with, and recognize that that's a really common reason for not sleeping, and it can cause a lot of troubles such as added stress on our heart.
Dan, is it true that we should take vitamin D in the winter?
It wouldn't absolutely when you're in the area of this far north. It's a good idea. Once you hit, I can't remember exact dates, but once you hit a certain number of hours of daily sun, you don't get enough vitamin D that's getting created by your own body that you're absorbing through the sun. You could spend the whole day that we have outside right now worth of sun not wearing a single piece of clothing, and you won't get the vitamin D from the sun that you need currently. Now, your body has the great ability also to store vitamin D. That's why we make it through the winter a lot of times without taking any sort of supplements with it. But some people don't get the amount, or they don't have enough vitamin D stored within their body to continue on throughout the winter. Those people could probably be helped out with a vitamin D supplement.
But
What's the best way to...
If you think about it, up north, if there's enough sunlight out there, it's cold out, and we're all bundled up, so there isn't much sunlight.
What's the best way to quit smoking?
We're
running short on time.
A well-balanced approach, working with counseling, friends, making sure that you think about if there's medications for you, as well as support groups out there for you as well.
How do I stick to my New Year's resolutions?
Make a decision to do so.
Actually, I would also encourage people to share their New Year's resolutions with the people who they care most about, and those people will become their support group and allies.
Nasty. You're nasty, that's true. Are energy drinks good for you?
In general, no. And in fact, there's increasing amounts of deaths associated with energy drinks, especially when people are exercising as well.
Especially the caffeine is quite dangerous.
And the levels usually aren't reported, and there's a lot of fluctuation in how much caffeine is actually found in those beverages.
How do I know if I should take vitamins?
There are relatively few reasons people should take vitamins, but there are some. And I do think that's a good question for that person to talk with their physician about.
I would say, other than vitamin D, I think many of us in the northern should think about that. One hospital did a study for a whole month of everybody that came into the hospital. 25% of the people admitted to the hospital were vitamin D deficient. And I think that speaks to a vitamin that is something that many of us should think about taking.
What's a good diet for migraine headaches?
It's really finding what maybe precipitates or causes that migraine. So see if there's creating a journal of when you get a migraine, if there's certain foods that trigger it. Some people it's wine, some people it's cheeses, so avoiding those things. But it's really, you got to look at specifically what individual foods are kind of kicking in those migraines for you.
Yeah, I think it's really especially fermented foods. And it turns out it's the tyramine that's in a lot of things. So pickled herring and the real cheese And beer is bad, and red wine is bad, and white isn't so bad. But it's the tyramine in certain fermented foods that may be triggering that migraine.
Gentlemen, this has been a great program, and I really want to thank our panelists, Dr. David Lear, Dr. Jake Praneski, Dr. Dan Tomaszewski, and our telephone panel and personnel, Nicole Jadolinsky, Christy Johnson, and Linda Liskowitz. Please join Dr. Westra in 2 weeks for a program on skin problems when her panelists will be Dr. Susan Ash, Dr. Heather Buchholz, and Dr. Chris Thiessen. At this point, I would just take a personal moment and wish Dr. Ben Owens, a former host of this program and one of my mentors, a very Merry Christmas and a happy holiday season, and extend that to all of you for watching. Thank you so much. Have a great night and happy holidays.